Hi, thanks for joining us. More than 440 million people are affected by diabetes globally, many of them forced to take insulin. DreaMed is set to revolutionize the way that diabetes healthcare is provided. We'll find out more on this episode of What's New TV. Eran Atlas, thank you so much for joining us on the show today.
Thank you very much, Jeremy, for having me here.
My pleasure. All right, so let's start off with something very topical, obviously, coronavirus. How has that affected diabetes patients as well as healthcare providers?
Well, I think that it catches right in the hot spot where people with diabetes are captured as people with risk to the pandemic, and they're afraid to go to the doctor. And also from clinic point of view, there are not, top ICU clinics that treat people with coronavirus. So they need to change the way that they treat people with diabetes. Now, it's interesting. In February, we had a big conference about diabetes technology in Madrid. And we had a consensus meeting discussing how to treat people virtually with diabetes. And all of a sudden, a couple of weeks after, we had actually to implement anything that we learned during that conference. So as far as we know from the customers that we already implemented our technology, they went through around March, April, mid-May to about 100% remotely. And now where they're coming back to the clinic, still in very small steps, about 30 to 50% of the way that they treat their patients are done remotely. So number one, everybody understood that it's possible to treat people with diabetes remotely, which is something that we pledged for a long period of time, and we are on some certain very happy that that was understood by the market. Number two, everybody understands that you cannot go back. So patients love it. I think that providers love it also. I think that there is a lot of opportunity to gain a better treatment for people with diabetes when it's done remotely.
Absolutely. I would imagine that being able to speak to a doctor, get the care you need from the comfort of your home and not have to travel to a clinic and perhaps expose yourself to additional risks is definitely a benefit in countless ways. And probably for healthcare providers as well, I would imagine there are lots of benefits for them on their end.
You're totally correct, but I think that the opportunity is even beyond the fact of all the savings with the travel and waiting in the sitting area. I think that the fact that control over when those virtual visits are going to happen is going back to the hands of the patient. When that is, you set this time when you have availability to see a doctor, and also you can, because it's remote, all of a sudden you have much more time to maybe set it more frequently than just see your doctor every 3, 4, 6 months. And what we know already from 1993 is that when the diabetes control and complication trial was published in the New England Journal of Medicine, is that if you're treating people with diabetes more frequently, you have a better chance to improve their control and avoid significantly all the risks that relate to diabetes. So that's why I'm happy for the people with diabetes that we have that opportunity to implement it on these days, because even the insurance companies understand the value in providing virtual diabetes management.
Okay, so let's get into DreaMed. Tell us a little bit about what DreaMed is. How does it help diabetes patients? How does it help healthcare providers who are working in the world of diabetes?
So DreaMed is an interesting startup company because usually startup companies are starting from the tech side. We started from medicine. We came out of one of the biggest institutes that treat people with diabetes here in Israel. We spun out of this institute in 2014, mainly focused on developing technology with medical logic inside, how to interpret it the way experts analyze the data and turn it into software. Our first product was an automated insulin delivery technology that was licensed to Medtronic Diabetes, and it just announced in June that they got a CE mark for that technology with our software inside to be start publishing in fall in Europe. And from that point on, we were focusing on how to help providers interpret data about people with diabetes. We were the first in the world that got an FDA clearance to use data from continuous glucose sensors and analyze it to provide a better insulin treatment plan for people with diabetes and an insulin pump. And we're pushing for this envelope, trying to create more and more tools that will allow people with diabetes and their providers analyze data faster, more clinically effective, and get a frequent touch point with the patient in a cost-effective manner.
Excellent. And I understand that a large part of that, obviously, when you're dealing with so much data, is artificial intelligence. Is that correct?
That's correct. We're using a very special artificial intelligence, what we call an expert system. So our technology, as you see here on the screen, the DreaMed Advisor technology, mimic the way experts analyze data and deduct from that data what is the best way to change the insulin treatment plan of a patient. The way that this technology works is pretty much the same as any all the steps that they are going through, similar to the steps that any expert provider are doing when they are analyzing the data. With this technology, we manage also to do a lot of clinical trials showing the clinical value, and we're now deployed in a very prestigious systems in the United States, including Cincinnati Children, Texas Children, University of New York, Stanford University will be onboarded this month, nationwide in Ohio. So there's a bunch of University of Florida, there's a bunch of big clinics that already adopted this technology. And for example, Texas Children adopted the technology during the coronavirus, also nationwide in Ohio. We did the entire training remotely, and now they are using our technology in order to treat people with diabetes in a totally virtual way.
That's fantastic news. My understanding is there's roughly 440 million people living with diabetes globally. The opportunity to help such a massive number of people who I know from friends who've got children with diabetes, there's this terrible fear that's ever present, and watching those glucose levels, having a tool like this seems like a godsend. What has been the reception by healthcare practitioners and parents and patients?
So we did a couple of testing to that. First of all, providers giving us a feedback that it saved them a lot of time in analyzing the data. They are think that the recommendation that this technology is being risen and they trust it as time goes by. And we'll also hear about from patient. One of the stories that we heard of a patient from University of Florida that picked up the phone after she downloaded data at home and asked the clinical team that they will run the technology with the algorithm because she present and felt how the glucose control is being improved. So we are very happy with that perception. I think that it's important also to note that within the millions of people with diabetes around the world and in the US, our focus is on those that take insulin. Those are usually need specialty doctors in order to help them manage the disease. And we're trying to offer a way to do it with a software because 60% of these people are being seen by primary care that not necessarily have the expertise to review their data and manage their disease. Think about it, what if we're going to proliferate expert knowledge with a software? And we have a clinical trial that shows that we're gaining the same clinical evidence as experts from leading academic centers in the US and Europe.
Okay, so just so we're clear and everyone at home is clear, the process is there's tons and tons of data. We're monitoring that data, and because of all of that data, we've got some artificial intelligence that can analyze it, go through it, and basically assess the amount of insulin to provide and when to provide it. Am I understanding correctly?
Not quite true. So let me try to make it more clearly. First of all, we're not doing a big data. We're doing something that's called personalized analysis. So each recommendation is based on the data of that specific patient. Number two, when a patient delivers insulin, they usually get from the doctor some sort of a recipe. And that recipe is allowing the patient to calculate the amount of insulin on a daily basis. What DreaMed Advisor is doing is actually optimize these recipes. These factors that allow the patient to automatically to calculate how much of insulin he needs to deliver. Now, usually in normal clinical practice, these recipes being tuned once every 4 6 months. Between these time, between visits, the patient is all alone. What we are trying to propose here is a faster way to analyze the data and try to get to a more frequent touch point with the patient to optimize this insulin treatment plan, what I call the recipe. We are managing to get to almost a bi-weekly regimen that our algorithm can just review the data and provide new recommendations.
That is fantastic, and thank you for that explanation. I feel a little bit more intelligent now, as if I almost understand what's going on. But that's great. It's very clear. The idea that instead of having to wait multiple weeks or perhaps months before adjusting the amount of insulin, now it can be done on even almost a bi-weekly basis. That's fantastic, and obviously that means a huge improvement in healthcare for those patients. All right, so let's take a little look into the crystal ball. How do you see things evolving and changing over the next 5 years? We're talking about more AI, better medication, better software, better apps, the hardware. What do you think? How do things change?
I think that healthcare is going on, especially in chronic diseases, trying to provide more tools on the patient side, taking more of the overload from the provider side, making sure that those who are seeing the providers are the ones that the provider actually needs to see. So instead of working on, a very clockwise regimen, you need to see your doctor every quarter. If you're doing good, then why should you bother yourself to see your doctor? If you are doing worse, why just see your doctor every quarter? I think that the way that we are going to move forward with our technology is try to provide as much as possible more recommendations on the side of the patient, try to allow the providers to prioritize those who are in need face-to-face with the provider, and try to make sure that only those who are needed that will get the actual treatment and actual care that they are required. So it will turn from a systematic way to provide care to a more personalized way to provide care.
Excellent. Eran, thank you so much for joining us on the show tonight. We certainly appreciate it.
Thank you very much, Jeremy.
My pleasure. And thanks to all of you for watching. If you like the show, please let us know. Like, share, and subscribe. Don't forget to hit that bell so you get notified of all of our latest episodes. If you have any questions for Eran, leave them in the comment section down below and we'll make sure he gets them. Until next time, I'm Jeremy Ladner, and this is What's New.